Hi there, my name is Dr. Carly Axford and I'm the founder of the Spinal Flow Technique. I want to do a video today about sciatica and the Spinal Flow Technique and how that can help you. So if you are experiencing sciatica, then this video is for you. Or if you know someone else that's experiencing sciatica, please share this video with them. The reason I wanted to create this video today was that in my life as a practitioner, as a spinal flow practitioner, but now as the trainer and teacher of the modality, I was one of the most common thing that people came to see me. So it got to a stage in my practice that most people came in had some type of sciatica or back pain, and it got to be so common that I didn't actually meet anybody that didn't have that. So that's, I guess, why I'm sharing this video. So one of the biggest causes that I found for people that are experiencing sciatica is a blockage in the foundation gateway. So this is the foundation gateway here. This is a spine and the nervous system. So those of you that don't know much about what I do, everything I do is around the spine, the nervous system, because to me, that's our master control. Our brain, spinal cord comes all the way down here and the nerves come all the way down the leg. So anybody that's got sciatica, nerve pain in the leg, it's got to come from the nerve from the sciatica comes through here, this area of the foundation gateway, but it also travels all the way up the spine and it starts off in the brain. So everything I share is to do with the connections of brain, spinal cord, and the nerves that come out. And if your body's talking to you or screaming at you with sciatica, it's like, how can we help you? So what I found and what I know is that often people that have sciatica also have a foundation gateway here that feels blocked. And so I speak a lot about spinal blockages, and what we're looking at is we're looking at the spine and the nervous system having full movement. How we know there's full movement in the spine is to really assess that every joint in the spine, we've got 33 movable bones, has full movement. Movement looks like that. So that's a joint that moves. A joint that's stuck feels like that. So there's stuckness, there's hardness, can be inflammation, but as long as there's hardness there, it means that joint is not doing what it's designed to do. It means that, and especially if you're looking at the joints of the spine, between one bone and the other bone, which is what a joint is, the nerves come out and supply the areas that it needs to. So if you can imagine that there's a blockage through here, so if there's a blockage through here, what will happen is that's where the nerve needs to come out to the sciatic, to the leg, to supply the leg. So if there's a blockage through there, which means lack of movement, it means that the joints aren't doing what they need to do, which can be interfere with the nerves that need to come out. It can be common that interferes with the nerve. When it interferes with the nerves that supplies the leg, you can feel sciatica, which is leg pain. So that makes sense to me. Some of the causes of sciatica and some of the blockages to the foundation gateway here, sacrum, ilium, the joint between the sacrum and the ilium is called the sacroiliac joint. Where that is in your own body is the dimple in the bum. So you can have a feel of your own dimples in your bum to see where that is. But again, if there's a blockage in there, it may be caused by repetitive bending, twisting. It may be an injury, and it could be an emotional cause as well. But despite what the cause is, please know that by seeing a spinal flow practitioner, you can have more movement to the joint, more ease. You can have the blockage, rather than being a stuck blockage, can be released or eliminated, so there's movement through there. And when the joint starts to move, when there's not pelvic rotation or instability or dysfunction, then muscles don't need to contract. They don't need to contract around the nerve that supplies the leg. And what can happen is we can get full movement into that foundation gateway, so the muscles around that can do what they need to do, hold and protect. The nerve doesn't have interference, and the symptoms that you may be experiencing with sciatica don't have to be there anymore. So what I'm saying is that our spinal flow practitioners have had amazing results with people experiencing sciatica. So if you have sciatica or you know someone that has, then please forward this video and let them know that there is hope. There's definitely hope. There's a lot of people, my practitioners are out there working with people every single day, helping them with symptoms of sciatica. And how they do that is do a thorough assessment of the foundation gateway, see what's going on, see if there's blockages, help you release the blockages, but also help bring the spinal wave in the body. The spinal wave actually is generated from the foundation gateway. So when there's a blockage or stuckness or rotation, it means less wave. And that spinal wave is what brings that healing intelligence, that life force up and down the body. So if that's getting stuck and there's not enough flow, that can be happening from the foundation gateway, and the spinal flow practitioners can help you with bringing more energy there, bringing the spinal wave up and down the system, decreasing blockages and creating more healing in your body, which therefore leads to less sciatica. So, summary, we'd love to help you. See one of my practitioners. They're located on my website, so you can find them. If there's not a practitioner in your area, we are teaching ways that you can start to help your body heal on your own. But right now, the best person to help you is one of our spinal flow practitioners.